Since 1986, whistleblowers have saved the federal government over $13 billion. And in reward for that, the whistleblowers, or what as they call them, relators, have been able to put in their pocket over $4 billion. And that's the federal government's way of encouraging whistleblowers, knowing that stepping out there and blowing the whistle on your company for perpetrating a fraud on the government, but quite frankly on all of the rest of us through higher taxes, that relator is able to recover $4 billion over that period of time. And there have been several programs that have been enacted that have actually increased the amount of whistleblowers over the last few years, which we'll get into later. But the point of this segment is to walk you through the types of examples we see day to day of whistleblowers bringing claims under the FCA, or the False Claims Act. Let's start off, Chris, with just an overview of mischarging or overcharging for goods and services. And since your specialty is kind of in the pharmaceutical field, why don't you cover some examples there, if you would?
Okay, well, the general purview of the Federal False Claims Act is any false claim that's submitted to the government and then is in return paid by the government. That comes within the purview of the Act. Any claim that kind of follows that particular setup is going to be actionable under the Federal False Claims Act. With the healthcare industry specifically, when false claims are made to the government, they're usually made through the Medicaid, Medicare benefit programs. So claims for drugs that were promoted off-label by their corporations, or prices that were not the lowest and best prices for those particular benefit programs. Any of those sort of claims are going to be actionable under the Federal False Claims Act. Also, some folks out there who work in the medical field may be familiar with certain billing practices that have come under scrutiny. Certain terms such as bundling, over-bundling, unbundling, or basically billing for medical services that never were medically necessary or should have taken place. And in fact, some folks out there are bold enough to simply seek reimbursement for claims for patients that never existed or never ever received any sort of health care service. And those are common billing schemes in the medical industry that are seeing a lot of action under the False Claims Act.
How about selling goods or services, James, to the federal government, whether it be military contractors with defective products? Why don't you give us a few examples of upcharging or false billing and or defective goods or services in the military context?
Sure. In the military context, you have many government contractors that either have contracts for goods or services, and they overcharge for those goods or services. One example of that would be munitions or ammunition or any type of weaponry that's sold that is charged too much for whatever the real cost is supposed to be for that. That impacts the taxpayer because the government pays more, and that impacts the military because they're not able to get all of the goods and services that they're supposed to get under their contracts. Another example for services, for instance, can affect military lives is those that are on bases abroad that are supposed to be looking at like electrical and issues within each of those complexes. If a company is looking at the electrical outlets and whatnot, and they're not doing it, well, that could create a hazard for our military servicemen and women. That can create incidents that can cause harm, bodily harm, and death possibly. And that is one thing that we are very interested in, is protecting servicemen and women, especially here on the Gulf Coast, with all the military bases here and all the people that we have to protect. That's one way, is through those services, making sure that those contracts are being followed through on.
Another example that I think is definitely pertinent here on the Gulf Coast and across the country are charging for services that weren't rendered in the context of like a hospital or a medical setting. Chris, would you expand on that a little bit, on what types of fraud you see on the federal government in that hospital or doctor's office setting?
Yeah, oftentimes hospital corporations will employ a business practice that would it basically will systemize a health care service, say a particular blood screen or blood test, or for example, let's just say X-rays. If somebody presents to the hospital under a certain code for an injury, say somebody comes in with a sore leg, the routine test would be to X-ray them, but then also to do a blood screen. Now, that blood screen would not necessarily be medically necessary, and if the hospital is routinely doing a blood screen on everybody who reports to them with a sore leg, then it could be found that that is a fraudulent claim against the government if Medicaid or Medicare is paying for that, because it's absolutely an unnecessary test in light of the symptomology at which they're presenting to the ER, and however it's being done routinely without a doctor's order as a matter of course in that hospital corporation. So that's a kind of an oblique example of healthcare fraud, but that's a good example of it, because what ends up happening is Medicaid and Medicare pay for services that they shouldn't have paid for because they simply just weren't necessary. And everybody sees the headlines with healthcare fraud these days and the expense of Medicaid and Medicare to our government. And what that does to us as taxpayers and even as small business owners, it's an enormous impact in the aggregate on our culture.
Right. Grants are a huge part of our federal government. The federal government provides grants to startup businesses, existing businesses that cover the gamut. James, will you give a few examples of grant whistleblowers and what kind of cases that are out there and claims are out there that whistleblowers have presented facts that the government has been fraudulently duped into issuing grants? I mean, sometimes huge grants, 8-figure grants that aren't used for the purposes that they were intended or that were misrepresented up front. Would you expand on that a little bit?
Sure. Peter, anytime you have a grant program that is handing a lot of money, a lot of taxpayer money to corporations, there is an incentive of greed and to defraud the government, unfortunately. An example of that would be, some of the stimulus programs that we've had that have gone to Wall Street. Any type of fraud that's occurred within that program, if there were services to be provided, whether there are certain ways that the money was supposed to be spent, if that didn't occur, that would be an example of a false claim. The government has given this money saying that this is what the corporation is supposed to do, and if the corporation doesn't do it, then that would be an example of that. There's an incentive for this, unfortunately, because there's a lot of money in these grants, and unfortunately there's an incentive to lie about it and to lie about how the services are being provided, especially if there's another way for the company to use the money that makes them more money.
In a nutshell, what we're looking at is, as far as whistleblower claims and the different kinds of categories, any time that the federal government, and we're also talking about state governments as well, that have been billed or charged for services rendered that weren't necessary, overcharged or overbilled for services that were provided but weren't reasonable in light of the circumstances, or if you were talking about a product that was defective, that never worked, they knew it didn't work for the purpose intended or is represented, and the state government or the federal governments were there charged for that, whether it be pharmaceutical, whether it be in the healthcare industry, whether it be insurance, whether that be in the mortgage field. You name it, anything that our state and federal governments are being charged or billed for based on fraudulent misrepresentations or omissions of key facts, and the whistleblower is encouraged through these acts and protected under the acts, which we're going to get into later about any retaliatory claims regarding employment. But most importantly, the whistleblowers are handsomely rewarded for pointing out the corporate fraud and can put a significant portion of the recovery back in their pocket for blowing the whistle on the fraud in the workplace.